Hello, good morning, everyone. This is a breakfast at UMHealth. I'm Professor Jenn. I'm the chair of the eHealth unit at the Faculty of Medicine, University of Malaya. Welcome to all of you, and thanks for joining us. Today, we're going to share with you a bit more about what eHealth is all about. But before we do that, I'd like to tell you a little bit more about the context of this eHealth. As we all know, the pandemic has created a lot of chaos and havoc in our life for the past 1 year or so. And it has impacted on us, not just physically, psychologically, socially, as well as spiritually. However, I'm a positivist. I believe that with every single challenge, with all the dangers that we have, there are always opportunities. And I would say that eHealth is one of those opportunities that has sort of launched forward this whole field for the past 1 year. And eHealth unit has been set up, and thanks to this pandemic, really, because it has given us a lot of opportunities to marry health with ICT. Okay. So for today, we have a really tight schedule. So I'm going to give you a brief introductions about eHealth, as well as then it's followed by Dr. Teo Chin Hai, who is going to tell us about mHealth and Telehealth Division. Prof. Yong tell us about EMR and clinical registries. Prof. Nasriah talk about health informatics, followed by Yew Kong, and then 10 minutes of Q&A. So what is eHealth? Simply stated by WHO in 2017, is the use of information and communication technology for health. So really, it encompasses a wide range of technologies, as we all know, and we have witnessed for the past 1 year, and it's all the technological tools as well as resources used to communicate, create, disseminate, store, and manage information. This is slightly different from biomedical engineering kind of technology that we are talking about. So for this particular eHealth unit, we focuses more on the ICT aspects of the technology. So the Faculty of Medicine, in collaborations with Faculty of Computer Science and IT, has established the eHealth unit in 2020. However, the history actually gone way before that in 2017, where eHealth initiative was established by the same group of people, but at that time, it was more looking at academic activities, research, and some small projects. It aims to use ICT to improve healthcare for patients and community. It really is a multidisciplinary team and comprises researchers, healthcare providers, computer scientists, and industry representatives. We even have a legal representative in our team. So really, the focus is to collaborate with academic institutions, government agencies, NGOs, consumer groups, and industries to conduct research, enhance teaching and learning, and ultimately improve and innovate healthcare delivery. So the vision of this eHealth unit is to lead research and innovation in eHealth. And the mission is to develop effective, sustainable, and people-centered digital solutions to address real-world healthcare challenges. So whatever activities and whatever output that created by eHealth unit hopefully will be used in the real world, in the hospitals, in the clinics, in the community, as well as in the university for teaching and learning. So with this, I'd like to introduce the divisions of eHealth unit in the Faculty of Medicine, and it comprises 4 divisions. The first division is eLearning, led by Dr. Yew Kong and Associate Professor Dr. Vinod Pal. Is to use technology to enhance teaching and learning for healthcare students, professionals, and faculty members. The second division is Health Informatics, led by Associate Professor Dr. Nasriah Zakaria. Is to use or produce graduates and leaders who are technologically adept in healthcare delivery. The third division is led by Associate Professor Pang Yong and Associate Professor Dr. Norimichi Hirahara, is to enhance the electronic medical record system and clinical databases to improve clinical management. Lastly, is the divisions of mHealth and Telehealth, led by Dr. Teo Chin Hai and Associate Professor Dr. Adina Abdullah. It aims to develop tools and test out tools to educate and empower patients in managing their health beyond the healthcare settings. So these are the 4 divisions of your eHealth unit. Now I'd like to invite each of the divisions lead to present what they have done and what they would like to do and how the whole faculty can be engaged in this eHealth agenda. I'd like to now pass over to Dr. Teo Chin Hai to present on the mHealth and Telehealth division.
Thank you, CJ. Hi, good morning, everyone. My name is Chin Hai, and I'm a senior lecturer here under the UMHealth unit, under the Faculty of Medicine itself. So myself, I'm co-leading this mHealth division with Prof. Adina, as mentioned by Prof. CJ before. Prof. Adina is from the Department of Primary Care Medicine. So today, just a quick one, I have 10 minutes, just to share with everyone the definition of mHealth quickly, and I will share the examples of mHealth projects in the faculty. And the third one is to share with all of you the division's goals and strategies. Okay, so what does mHealth mean? It actually stands for mobile health, and according to the WHO, they define it as medical and public health practice supported by mobile devices, such as the mobile phones, smartphones, patient monitoring devices, PDAs, and other wireless devices. Okay, so these are just some examples that I personally know of, the projects, the mHealth projects in the faculty. I'm sure there are many more, just sharing some of the example to reflect the definition earlier. So the first project that I would like to share with all is the Cosmos project. So this Cosmos project aims to help monitor COVID-19 patients who are quarantined at home. So we have developed some app. Actually, we are using Telegram in the patient phone, where they submit to us their symptoms every day, and the doctor from the PPUM side will correspond accordingly. So this project involves multiple departments: the primary care, the emergency department, infectious disease, now PEDS, and as well as, of course, the Faculty of Computer Science and IT. So the the second project on the right is called the Empower project, which is also an mHealth project. It's actually on dengue. There are three sub-projects under this Empowered project. The first one aims to educate the public about dengue using a gamification approach and through social media. So it caters to the wider community outside using mHealth. So the second sub-project under this project is actually something like the Cosmos to monitor dengue patients when they go back at home. And the third sub-project under this Empower project is actually to sort of help doctors instead of patients to predict or to predict which patient are likely to develop severe dengue, so that the doctor could uh, manage to provide treatment accordingly. Okay, so the next example I'm going to share is actually it's actually another project, but not by us. It's involving Prof. Ng Kwang Hong and Prof. Chu from the PEDS team, as well as the engineering. It's actually called the Don't Cry For Me Baby. You might have heard about it before. So what they aim to do is actually they aim to help parents. They develop an app for parents to use so that the parents could understand why the baby cry. Then so that the parents could cater to the baby accordingly. Okay, so the next example is the Gum Park, which is led by Prof. N. Yi from the Psychological Department of Psychological Medicine. So they developed an app to help smoker quit smoking, of course using some theories and personality traits. Okay, the eHealth project is currently being researched in the RUCA as well as endocrine. So this one is a bit more unique because the app itself is connected to gadgets such as the BP machine. Uh, this app or project actually help to monitor chronic disease. I think they're looking at the diabetes as well as hypertension, monitoring this patient at home. The next example is the cardiac rehab project. I think this is led by Prof. Anwar from rehab, as well as Dr. Lee Wang Ling from the nursing department. So they are trying to use mHealth to support patients in cardiac rehabilitation. So another example is a Crossmos, which is actually involving teleconsultation. So it's actually for diabetes patients whose care or follow-up were affected during COVID pandemic because their follow-up was cancelled and postponed, but they see the need of following them up using phone teleconsultation. Now the next one is ScreenMan, which is a web app. It aims to empower men to come forward to screening, and this is more for the community. And currently, it's also being researched about its implementation, whether it can be implemented in clinic kesihatan. Okay. Now, these two examples are actually touching on decisions aid. The first one is on starting insulin therapy, and the second one is on breast cancer. So the first one is actually a website developed by the team to help patients make decision to start or not to start insulin. The second one is actually on early breast cancer treatment developed by I think Prof. Ng as well as the team, Prof. Aisha and the team from the breast clinic. It's in the form of app and a web. So some more example, the bladder explorer is by Prof. Julia from rehab to help spinal cord injured patients to decide on the method to empty the bladder. This is in iPad format. And this DiaSense is led by Prof. Chiu TK from computer science, also to monitor diabetes patient, but it has more sophisticated function inside. The food book, it aims to educate children about and also to combat childhood obesity, led by Prof. Liu, I think years back, but this project has been put on hold. The Med Assist, as its name mentioned, the medication assistant, also developed years ago, aimed to improve medical compliance, but it has now been absorbed into a bigger app led by Prof. Pauline. Okay, so I'm just sharing with you, those are just some examples. I'm sure there are a lot more that are being conducted in the faculty right now. And those that I've shared with you, they are in different stages. Some has been integrated to the clinical practice, some are still in research, and some has been discontinued due to various reasons. Okay, next, maybe we'll just look into the goals and strategies of this division. The first goal is actually quite direct, to create more mHealth research and solution. Why we put that solution is because we don't want the products to just being kept or end at the research stage. We want it to be used, integrated in clinical practice, or in the community by the people. So the first strategy, as I mentioned before, is to create more solution, of course, backed by research evidence. It's good to practice new intervention or services based on evidence. And the second strategy is actually for us to help researchers or friends or colleagues of any of you to initiate mHealth projects. Okay, just also to proliferate or increase or create more mHealth solutions for the patients. And the second goal is actually on capacity development. The first strategy is actually focused on researcher, how to conduct mHealth research. The second one is more for the doctors or GPs or healthcare practitioners about what are the useful mHealth tools that you can use out there. And the third goal is focusing on research, how to go about managing mHealth grants, what are the resources available in terms of mHealth, as well as how to protect your idea, your product in terms of IP, and last but not least, also how do we commercialize all the ideas, all the fantastic ideas that all of you have to make it more sustainable as well. So these are the three goals that we are doing. Moving forward, we welcome any collaboration. If you would like to talk to us, feel free to email us. Happy to discuss, happy to improve existing project, happy to also work together to initiate new projects. And of course, we are happy to share resources. And we also conduct training session and webinar and journal club and so on. Please welcome to join any of those. And we are also hoping to build registry about mHealth as well as eHealth projects in the faculty. First, to avoid duplication of work. Second is also to showcase, actually we have done so much in the faculty to showcase the faculty's strength as well to the whole world maybe. And last but not least, also to learn from each other lah. So I think that's all from me. Together. I think we hope that we could move towards making the faculty as well as as a frontier in mHealth. I think that's all from me, CJ. Thank you.
Thank you very much, Chin Hai, for a very comprehensive presentation. As you can see, we have done a lot. It's time to consolidate and then move forward and to achieve greater heights. Now I'd like to ask Associate Professor Dr. Pang Yong Kik to tell us a bit more about EMR and Clinical Registries Division. Prof. Pang, over to you.
Okay, good morning, everyone. Can I share my slides? Okay. Good morning, everyone. First of all, thank you very much, CJ. I'm so glad to actually meet everyone, despite the constraints and challenges posed by the COVID-19 pandemic. So as you can see, ICT has found a way to connect us via the technology platform. So what I'm going to share with you this morning is regarding EMR, or the Electronic Medical Records and Clinical Registries divisions. So the first question you may ask, what is EMR? EMR is an electronic record. It's a record system where the medical data of patients are collected systematically and stored electronically in the digital format. These records may include demographics, medical history, vital signs, physical findings, medications and allergy history, laboratory test results, radiology images, and billing information. This record can be shared through a network-connected portal with different privileges assigned to different end users. So what are the differences between EMR versus the conventional paper records? Conventionally, records are written with pens on pieces of papers. They are viewed in their original format and stored in the record office, which is a physical office. Electronic records, on the other hand, are data typed with keyboards, viewed with monitors, and stored in the servers. But is that all? No, definitely it's not. It's not a mere change of format from paper to electronic format. So let's see what are the differences of EMR versus paper records. We know that data stored in the server, it is in a compressed format. Hence, they only occupy a very tiny space in the server. Essentially, it is now possible to store a patient's lifetime health data in the server. It is also more secure as the database is password protected. Besides, all data can be backed up in a remote server. In the event of a natural disasters, such as actually typhoon, fires, and all these things, or man-made calamity such as war, this reserved data can be recovered and repopulated into the site server. And what about data retrieval? Data transmission, while it is light speed, okay, we know that there's no lag time involved. And this is really incredible. Since the lifetime of health data can be stored, we can virtually gain access to the whole of a patient's history and other health informations. Besides, the server works 24 hours a day and 7 days a week. So unlike paper records, this process does not require human energy and time for the transportation. And we know that doctors' handwriting are by and large terrible, okay? We have a name for it, doctor's handwriting. So most of the time, the notes are not written, but they are being scratched on a piece of paper. And it's sometimes very, very difficult to read, even for people in the same line of practice. Digital text, on the other hand, is standardized and easy to read. Besides, with the software embedded in the EMR system, spelling and grammar can be checked automatically by the software. As you can see here, I show you the picture here. The wrong spelling is immediately picked up by the software. All right. The regular doses for all the drugs are provided in the system, and hence this will avoid the prescription error. In addition, references such as guidelines, formularies can be incorporated into the server. Data in EMR can be presented in many different formats. Unlike the paper copies, is one and the only. Okay, so this can be presented in various formats to suit the way how we wish to look at the data. For instance, in this diagram, the individual laboratory results are displayed. However, in other situations, I believe that we may like to view the trend or progression of this result. For this purpose, we can link or string all these results in a table, as shown in this picture here. This will enable us to evaluate clinical progression of the patient or response of the patient to certain treatment. There are also times when certain information, such as a vital signs, are better appreciated if they are displayed in a graphic form, such as what it is shown here. And then what about the other advantage of using the data coding? We know that coding improves the categorization of diseases as well as the search function. There are various coding systems in existence in the world these days. For instance, the one used in our center, the ICT-10, and a growing popularity of the SNOMED city. Okay. In reality, anything can be coded, not just the diagnosis. And this may include symptoms, signs, procedures, lab tests, and imaging tests. And one of the features of computer, which is unrivaled by human brain, is its capability in data searching. Yes, all of us actually like the search function, such as Google, because it is convenient, quick, and precise. A similar function can be developed for EMR. In addition, we can link and string all the relevant information together. This feature will allow us to follow the sequence of the history, trend of laboratory results, and progression of abnormal images. Well, in fact, the best is yet to be unleashed. So, you know what am I going to talk about? AI. Yes, everyone talk about AI these days. AI stands for artificial intelligence, and it sounds like a science fiction story in movies not too long ago. However, some of the narrow AI features are already in our systems. For instance, flagging of abnormal lab results is already there. What we need to do is to push further to develop a system that will alert us on this abnormal result in a timely manner. It will even better if the system can propose the cause of the abnormality and subsequently suggest further course of action or treatment for this abnormality or this condition. Traditionally, when we mention data interpretation, we tend to associate it with text data interpretation. However, we often forgotten images are often read the same way as text data by computer. And hence, the latter is quite capable or even better in interpreting images. Often, this includes superficial lesions, such as skin abnormalities or abnormal radiological images in chest X-ray, CT scan, and MRI. In mathematics, we know that output is equal to input. And hence, The data that humans or computers are capable of interpreting is very much dependent on the quality and quantity of data captured. In this regard, quality of data is dependent on the accuracy of information that we collected and how relevant it is to the condition that we are investigating or interpreting. Quantity, on the other hand, is related to the completeness of data that we captured. Lack of these two elements may lead to misinterpretation or wrong diagnosis, and this will further result in inappropriate or wrong management. So besides computers can be set to guide data entry, we can design the templates in such a manner that some pre-specified data is considered mandatory. Individual finding may be regarded as unique, but if we put all the data together, this will produce a huge database called the mega data, some would like to call it. The strength of mega data is that it will provide a more insightful view on the disease prevalence, best diagnostic approach, and treatment modality, as well as the prognosis of the disease. So this leads us to medical registries, which is, I think, underutilized because the paper copy is actually quite labor intensive in creating the medical registry. But I think we have the opportunity to do it right now without so much efforts. And what are medical registry? David Solomon and all define medical registries as a database of identifiable persons containing a clearly defined set of health and demographic data collected for a specific public health purpose. So in modern registries, by using the web technology, it has allowed us a much wider scale of discovery. This includes population-based studies on medical care, services, and technology, early diagnosis and risk group monitoring to healthcare planning, and identifying areas in healthcare services policy that require intervention. And the question is, why we bother to create registry? This author, Bogdan and all, mentioned that medical registry have the following role. Medical registries provide highly reliable data, hierarchically only rivaled by randomized controlled trials. Registries can also contribute to research by providing resources for observational studies, improving research design, studies of processes, and hypothesis testing. So in summary, the incorporation of ICT in documenting as well as storing of data have changed the way how we practice medicine. It has enabled us to stretch far beyond the traditional border and perhaps into a different dimension. When the data is captured systematically, it will provide useful guides and understandings on many aspects of healthcare, which include diagnosis, treatment, healthcare financial planning, and health policies. If we position this correctly, it will serve as a very useful tool for clinical care, research, as well as learning and teaching. With that, I'd like to thank you for your attention.
Thanks so much, Pang, for giving us all the possible ideas and potential that EMR can give and to help our patients. As you quite rightly pointed out, the full potential is yet to be unleashed, and we are quite far from it. But there are already many questions coming through in the Q&A and the chat room. But we'll reserve that for later. But I'm sure Prof. Pang can address some of the questions as well as Dr. Teo. All right.
Thank you.
Now I'd like to hand over to Associate Professor Dr. Nasriah Zakaria, who will tell us a bit more about what's this concept about health informatics. Over to you, Nasriah.
Thank you, Prof. CJ. Let me share my slide. Hold on. Can you guys see it? Okay, I'm going to start my session. Hi, I'm Nasriah Zakaria. I'm a new face at Faculty of Medicine. Actually, I just joined Faculty of Medicine a few months back. First of all, I would like to thank to the leadership of Faculty of Medicine, Prof. Adiba, Prof. April, Prof. CJ, for letting me join this faculty with one mission, which is to expand the eHealth area in medicine and in Malaysia, basically. Before I start, I just want to say that I have
Looks like we've lost Nasriah there. See whether she comes on. I think to save time, I think we'll move on to the next speaker while we sort this out. So I'd like to ask Dr. Yew Kong to present on the use of technology in teaching and learning, another very exciting field that I'm sure he can share with us. Over to you, Yew Kong. Okay, we'll bring the slides on.
Okay, thanks, Prof. CJ. So we will proceed with the section on e-learning. Can we go to the e-learning slides, please? Okay. Okay, good morning, everyone. This is the e-learning team at the Faculty of Medicine. So the e-learning division was set up in 2019, and our initial question when we set ourselves up was, how do we get people to use e-learning technology? Of course, in 2020, the question was answered in a very dramatic fashion by COVID, and e-learning became the de facto norm for all of us who are doing teaching. So what has happened is over the past 1 year or so, the e-learning team and our focus has coalesced into 4 elements. So I will use this next few minutes just to introduce you to these 4 elements. The first being e-learning online courses. The second being e-learning innovation. The third being instructional design. And lastly, we are also embarking on quite a number of e-learning research and trying to get our experience in e-learning publications. So the first one is the online courses, which currently take the form of the health research online courses. Initially, it was a set of workshops face-to-face delivered by lecturers in the Department of Primary Care Medicine. Eventually, it was developed into a series of courses to cater for busy healthcare professionals who would rather access it over a few hours every week instead of coming and taking leave for 2 or 3 days. So I'll show you examples of these courses that we have. The first one is the longest running one. It's called Introduction to Research for Healthcare Professionals. In 2016, it was launched, and so far we have trained a mix of both clinical masters as well as outside users. 976 people have registered in total. The next one is the Introduction to Academic Writing. This one was developed with external consultant, and it has been offered a number of times, not so regularly. The third one is actually Manuscript Writing Made Easy, again adapted from our research workshop on thesis writing. In 1 year alone, we have managed to register and train about 466 students on this topic. And the last one that is currently undergoing some form of pilot testing is a clinical audit and introduction. Now, I know a lot of you are wondering why is FutureLearn not mentioned. This form is actually based on a platform called Open Learning, and I'll come to that in the third element. So you see that we run courses about 2 to 3 times a year for each of these, the ones that we have developed so far, each one taking between 4 to 6 weeks. So we want to continue to support the faculty in developing new courses that appeal to medical trainees. We want to try and expand the market or do some form of business development to other institutions and also perhaps the local regional market. We are also keen to really support and guide departments who are interested in developing FutureLearn courses, as this is the official platform for University Malaya. And to cap this off, we have recently met with ADAC, and the Faculty of Medicine is actually the first faculty to form some kind of partnership initiative with ADAC to do the process of FutureLearn instructional design at a faculty level before moving to the centralized ADAC instructional design level. This is expected to allow you in the Faculty of Medicine to fast track your FutureLearn courses rather than relying on the bottleneck that I think is building up at ADAC. The second pillar is the innovation of e-learning, and the virtual patient project is probably the best one that we can use to explain what we mean by innovation. So when clinical clerkships were put on hold, we were approached by the faculty management to develop a virtual patient project, and we worked with the e-learning team, clinicians from Department of Primary Care Medicine primarily, and the FCSIT team that had been formed due to the Cosmos from the Cosmos project, comprising lecturers and student developers. So the idea of the virtual patient platform is that we have 3 modules. One is the students' game module, where they can test out their diagnostic and examination skills, perhaps the clinical reasoning with virtual patient. We want to develop a user-friendly case writer module so that lecturers who want to develop cases can easily build these cases to be hosted on the platform. And lastly, some form of management control so that we are able to track the users, we are able to produce metrics on what kind of decisions are being done correctly, what kind of questions are being asked correctly, and which ones are irrelevantly being asked. You can see that from June last year, we are now, having developed the first prototype and the first version, we are now pilot testing the platform. And over the next months or so, we are going to do a series of user engagements with the various stakeholders that we believe, that we know are necessary to make this project fit better with what the faculty requires. So we are going to develop a case development committee. We are also going to approach lecturers who are interested to develop cases to populate the library. So some of the features here are, we have an algorithm that allows clinicians to test and train clinical reasoning through tailored cases with very specific feedback functions. We are probably, since it's our own platform, able to cover unique cases that are such as tropical diseases that are not available in other virtual patient platforms. And the assessment of clinical reasoning is available via a scoring system that we are also developing. The third pillar is instructional design, training and support. So we have been we now have moved to a more consolidated approach where we have department level training packages. So Dr. Vinotini leads this one. She teaches, she and the team are able to provide training to departments on instructional design, on educational tools that are useful for teaching, and lastly on how to develop course or module, online courses or modules, which are MOOCs / FutureLearn. ODL, we've also met with CMC set to try and facilitate that, and also working on Spectrum. The last element is actually the e-learning research, training, and collaborations. So I think this one is worth highlighting because we got our start, I think, a lot of us in these projects. The capacity that was transferred was helpful, certainly, in getting e-learning started. So the Accord project was a EU grant under Prof. Chris Boy, and he. The Accord project is a EU grant under Prof. CJ. Aims to develop reusable learning objects, and you can see it's a partners are from the UK and the EU, and as well as in UPM and Taylor's in Malaysia. So these are some examples that we've been working with various clinicians, geriatricians like Tan Kit Man, nursing lecturers like Chong Mei Chan and Li Wan Ling, and Li Yong, to develop a series of short reusable learning objects on different topics that can be used to teach students in our faculty. We've also tried to expand the concept of e-learning co-creation through a hackathon that we conducted last year. Another project that was foundational was the EU grant under Prof. Chris Boy to develop online learning for pediatrics on early childhood nutrition. This was with Germany and some UK partners, as well as the Thai partners. So you can see that it develops very tailored modules on early nutrition for use in our region. So this is my last slide. There are many stakeholders and there are many experts. I believe that the team that I show you, certainly there are people who are better than us out there in the faculty working on e-learning, but this means that there's much opportunity for us to work together. So across the students, academicians, FOM, Central, as well as the e-learning is going to come together in a big way. I've tried to map out some of the things that are already happening for us in e-learning here. You can see that each one is actually populated already. So moving forward, we want to say that the Future Learn FOM ADEC model really facilitates course development. Come to us if you have an idea. We're happy to help you develop it. We want to work with departments to increase training skills and confidence in using e-learning further for our lecturers. We want to innovate and conduct more research on this e-learning area, as well as we are trying to, like the registry mentioned by Chin Hai, to develop a e-learning website to celebrate and showcase the e-learning that we have in our faculty. So these are the people, the various people, and I think we'll put the emails later.
Thanks very much, Yew Kong. Let's now get back to Nasriah, see whether she's able to get back online. Yep.
Prof, I'm here.
Great. We'll control the
Okay.
slide from here, Nasriah, if that's okay.
Yeah. Yes, please.
Okay. Yeah, you can start now.
So my example is how internet fails and how you're gonna deliver eHealth if the internet is not as stable. Okay, anyhow, I'm Nasriah Zakaria. I'm a new face at Faculty of Medicine. So many of you may not know me yet, but I just joined the faculty a few months back. First, I would like to thank to the leadership of FOM, Prof. Adiba, Prof. April, Prof. CJ, for bringing me on board, basically to help to establish and to basically move eHealth forward in UM and in the country. So let me, can you go to the next slide? Okay, so by definition, I'm going to talk about health informatics, what is it about, and where we are heading towards in the coming years. So there's so many definitions that you can find out there. But one simple definition I can share with all of you is health informatics is a scientific branch that is concerned with data collection, processing, analysis, storage in healthcare. The other keyword is an intersection of information technology, health science, a broader view of health informatics. And many of my medical students who I've taught before in health informatics, they are so concerned whether they need to know how to program, whether they have to know all the technical part and whatnot. But this part of health informatics is interdisciplinary or multidisciplinary areas where and informaticians need different kind of skill sets or a combination of skill sets. Next. So the title of today's talk on our breakfast session is Marrying Health and ICT. So indeed, this is really true in eHealth and health informatics in general. If you can see this diagram, I should acknowledge that this is from one paper that I got. This is the Health Informatics Competency Framework. It's a combination work from various professional bodies in health informatics in the world, such as American Health Informatics Association, International Medical Informatics Association, the Certified Health Informatics Australasia, and the Canada's Health Informatics Association. Basically, if you see this competency framework, it does show that health informatics is a very interdisciplinary and multidisciplinary, comprises of health sciences, information science, ICT, and there's also the element of management science. And over the years, this field has been established for more than 50 years. It has its core principles and methods. So we can see in the literature that there's so many theories that came out from just to solve problems in healthcare and IT. So it's really marrying health and ICT in general. Next. So in our environment in University of Malaya, we have two running hospitals, a teaching hospital and a private hospital. And we have three faculties which deal with mainly with health sciences, which are the Faculty of Medicine, Faculty of Pharmacy, and Faculty of Dental. So each of us are doing different things that use technology, where clinicians are making use of data, information, and knowledge within our ecosystem. So it's very important that we look at this area seriously now and try to see where we can work and how we can complement each other in order to make use and optimizing all the systems that we have in our environment. Next. Can we go to the next slide? Okay, yeah. For example, if for clinicians especially, maybe you're still wondering what informatics is. So I took one example from this website. This website is created by Prof. Abdullah, and he was a surgeon, a retired surgeon at Nasriah Hospital. He's very into we call that IT and health for many our So this diagram really depicts what health informatics. One example of health informatics, whereby we have multiple systems. So in our environment per se, we have iPesakit, which is sometimes we think is electronic medical record. Sometimes we can also think as a health hospital information system. Why I say that? Because there's many other subsystems that's playing in the background. So for example, we have electronic medical record, which is iPesakit in UMMC. And I think UMSC is using part of iPesakit. At the same time, we have other subcomponents like LIS, Laboratory Information System, Radiology Information System, Pharmacy Information System, that's feeding data and information to the electronic medical record so that clinicians can make use of those and make some good decisions within using this information. The other part that is very important when we talk about informatics, we have to think about data, information, and knowledge. So we are using or we are collecting all the data through electronic medical record. Then all this data are processed to become information, and later on with some subcomponent that will be producing knowledge that will help physicians to make decisions. I think in the next slide, you can see what I'm describing clearer. Next slide. Oh, okay. So on top of that, with all the things that like as clinicians, you are using all the data and whatnot, we also need expertise of people who are working in health informatics, specifically to understand the clinical workflow, to understand the software design and development. Even though we are buying from vendors, we still need to understand the software design and development process. And then we need to really take care of integration and interoperability, because there's no use of buying all the subsystems if they are not talking to each other. And if we are talking about an ecosystem in Malaysia to have paperless hospitals and information exchange hub, we need to make sure everything is interoperable. And the standards and coding, like Prof. Pang just mentioned, how important coding system can help in diagnosis and also for billing and whatnot. And the last one, and system assessment and evaluation. We will never know the quality of our system if we don't do the assessment and evaluation. Next slide. So this again, one figure or depiction to show that information is always flowing from one entity to another. and it's usually coming from the medical record. So the electronic medical record is the core thing, and information is flowing all over the place and coming back to the medical record so that clinicians can make use and harness the data within the electronic medical record. Next slide. Next slide, please. Okay. This also showing how information is important. So I think by now you can also make some conclusion that informatics really look at the core, which is the information side. Okay, so again, this is how information is flowing from one entity to others. As my colleagues have mentioned, this is just the beginning. We have a very stable electronic medical record in PPUM or UMMC, but we can explore and harness more data for many other purposes like biomedical research, having registries, national registries that can be shared throughout the country. And we need to have standards, guidelines, and whatnot in order to guide for clinicians to use based on the data collected in from the medical record. Next slide. Okay. Okay, the last few minutes, I just want to spend 1 or 2 minutes to talk about why informatics education and training. Yes, we do have people in computer science, we have people in medical school doing informatics, but there is a need to have continuous education and training. Computer science or IT knowledge alone is not sufficient. We have to produce individuals that have both worlds, that have the computing and communication technology knowledge, and as well biomedical areas, and the need to make practitioners understand how to make use and how to harness the data within our electronic medical record or other subsystems. There's a lot of career opportunities that we have ahead of us that we can build together in our nation to build this health informatics career. Next. This is just 2 slides. I think you're going to get a copy of this recording, right? Just these 2 slides showing that in the world, we have so many programs, undergraduate programs and postgraduate programs that offer informatics degree. And there are some degrees are offered within a medical school. So yeah, this is an example of postgraduate. Can we go to the postgraduate? Yeah, so for postgraduate, we have all the top schools in the world that's offering what we call that masters in informatics area. And last but not least, the other part is so for certification. So for those clinicians who are interested in this area, but you don't have to do masters and whatnot, but you can take professional certificate. So one certificate that is very well known, University of Science Malaysia, they have taken this course 10 by 10 certificate in health informatics that's offered by American Medical Informatics Association. Is a graduate level certificate that can be taken by clinicians and other professionals who are working directly in eHealth or health informatics. The last one is our roadmap, where we are going from here. So we have 3 goals. We want to try to teach our medical students and other degree students who is working directly in healthcare. We want to train them in health informatics. And then we're going to also try to have a higher degree, like postgraduate degree in informatics, so that we can produce the next, the future leaders and technologists. And last but not least, we want to work with many stakeholders, different stakeholders that Prof. CJ said, like the industry, the NGOs, the consumer groups, to understand about how we can expand this career path and how we can have health informatics as a professional career in the coming years in our country. With that, I thank you for your attention.
Thank you very much, Nasriah. As you can hear from Nasriah, that there are lots of, again, a lot of potential in health informatics. That data, if remain data, is useless unless we convert it to useful information. And how we actually collate, how do we actually analyze them, process them, and also disseminate and use them to help with our patients and research is the power of information. So I think with that, we only have a few minutes left, but please stay on because there are a few more. Yeah. So let's just, I think it's, yeah. So I think with that, I think it's okay. We can just go on to the Q&A, not an issue. Yeah, we'll just go on to Q&A. So I think there are lots of questions, I think interesting questions, which I would try to get them to be answered as much as possible. I think there are lots of questions regarding mHealth, whether these solutions are under development, whether they have been commercialized, and how to ensure sustainability. I'll invite Chin Hai to tell us more about this.
Thanks, CJ. So I think for the past example that I shared, some have already been developed, used in clinical practice, some is still in the development phase, some is still in the needs assessment phase. So there are various stages that the projects are in. And in terms of commercialization, I must admit myself, I haven't done any, but our friend, Mr. Teo and Prof. Adina, Prof. Sharina, and the team in Connected Health, it's a spin-off company from they have been commercializing, not sell out, but I think license out one of the app called Chief to some companies outside. So we are learning from them as well. And some of our projects in the pipeline, like the VP, maybe the virtual patient one, we are also thinking about licensing to commercialize it and make it more sustainable in the future. Also, just a little advice about all these things, the sustainability thing. It needs to be thought out from the start. When you have developed it, what are you going to do? Do you have funding to support the app forever? Like the server cost, the service fee, the domain cost, forever you need to pay, and whether you are planning to build, operate, and transfer it, sell out your app that you have developed after you have done it, or license it out. So it has to be thought upfront what to do once you finish.
Thanks, Chin Hai. So I think it's absolutely right. I think Prof. Cheong, Suk Ching, you're absolutely right. Sustainability is important. Many of the times, as researchers, sometimes we just build things, but we never really thought about what's happening. It's like a baby is born, but who is going to look after the baby until he grows up, and hopefully he will die prematurely, kind of thing. So I think that's a good question. I think there are many questions about EMR. Pang, are you there, Pang?
Yes.
Great. So there are questions about the possibility of cloning EMR for the purpose of teaching and learning for students in FON. And then there's also another question about whether we could actually extract data from EMR and put them directly into databases such as RedCap so that clinicians, researchers can use them for quality improvement projects or for research purposes. Would you like to answer that, Pam?
Yeah, thanks for the question. I think, as you can see, actually, there are many people interested to exploit what we can actually have from the database that we already have in our center. Okay, so some actually people put it. Data now is actually the oil of the 21st century. It's very valuable because data is very useful not just for the patient care, but also for teaching, learning, and research, as alluded by the various speakers. So the question is whether we can actually clone the data and then use it for teaching purposes. I think for bedside teaching, I think the conventional so-called bedside means the patients by the patient's side. But with the new understanding of bedside, it could be actually the bedside in any hospital. And then we just retrieve the patient information from the EMR. Of course, I think you can actually request access to certain patient if you wish to actually look at the patient information. I think as long as you are in the hospital setting, accessing the data via the hospital Wi-Fi or the Ethernet, usually the record office will actually provide access if the reason is valid. So we do not really need to clone it because cloning in that respect also means that the record office or our IT team may actually potentially lose some control over the other the server, particularly if the patient's information identities can still be recognized. Okay, but talking about the actually transferring data into another server, what we call the parallel server, for research purpose, I think it has been done by other centers. So what they do is the data actually is transferred into another parallel server, and it's a one-way flow, meaning that information going in that direction will not come back. So they can actually do all this analysis, whatever they like with the information at the other server, and whatever changes will not affect the server for the service. So this will ensure that actually data, no one mess up with actually the service data. But of course, I think this one need additional investment, meaning that I think you need to invest on the parallel server, and also the need to talk about the terms and condition, and how do we anonymize actually the patient information. And there are some actually conditions attached to people who are accessing data in the parallel server. So my answer in short, yes, it is possible.
Okay, thanks very much, Pang. I think there are many, many questions pertaining to EMR, and I think absolutely right. I think there are lots of potential, but this requires, you know, the innovators, the researchers, the clinicians to work very closely with the IT department from in UMMC, for example, in our setting. And as you know, I mean, UMMC has committees to try to push this forward, but unfortunately, as you know, it may not be going as fast as we expect it to be, but I'm sure it's going in that direction. I think some of us are trying to build up clinical registries, databases. There are a few successful examples which has been already implemented, but doing it in the larger scales and catering to different diseases, registries may take a bit of time. So I'm aware that the Data Policy Committee is trying to draft out some policy, some flow, some SOPs to guide us, try to work towards that. I'm sure the UMMC management will work very closely with us to make this happen. So
yes,
that,
I believe because it's a big project, it has to be actually agreed as well as facilitated. I think no actually single individual can do it actually single-handed.
Absolutely. And issues such as privacy, data protection, all this has to be in place so that people can trust the system, trust the flow. Otherwise, once there's any issues with privacy, then everything will put to a stop again. So I think this has to be trashed out very carefully. But once that is done, I think we will just, you know, really can unleash the full potential of the system, as what Pang has said. Yeah. I know it's already way past 9 o'clock, but I think there's one question about e-learning. So I think from Prof. Chan, Yew Kong, we noticed that you have left out learning experience with respect to acute medical care. Would you like to comment on that, about e-learning experience in the setting of acute medical care?
So I think this is a very welcome comment. It means that my radar is not as wide, and I acknowledge that actually. So Prof. Chan, I would really love to get in touch with you after this to find out the work that you've been doing.
Absolutely. I think there's a lot of potential, especially in virtual patients, Prof. Chan, whereby the scenario can be a really acute problem, and we can give a time limit, for example, to the students, so that it's like a game. But within that time constraint, they need to make clinical decisions about acute management, for example, in ICU or in in the OT, whereby there's an emergency. So I think there are lots of potential there. So I think Prof. Chan is definitely a very good platform. I think virtual patients, for example, which is able to address that clinical reasoning aspect of learning pedagogy. Prof. Chan. Yeah. Okay, I'm just aware that it's already 9:05, and Shams promised me that he will capture all these questions, and then we'll look through them and try to address them. We know who you are, so we will try to get back to you try to answer all the questions as fast as we can. Okay. I think with that, really happy that all of you have joined us in this journey. And eHealth is for the faculty, for UM. So we welcome collaborations, not just within the faculty, but outside the faculty and also the rest of Malaysia. So we hope that this eHealth unit will be a place to serve you, to innovate together, and then together with that, we hope to improve our teaching and learning as well as research, patient care using technology. Okay. So with that, thank you very much and have a good day.